Hello, I'm Lori Steiner, sitting in for Armin Budish. Welcome to Golden Opportunities.
Today, can you avoid adding insult to your injuries? We'll prescribe how to prevent problems before harm happens. Then, there's no place like home. We'll offer advice on aging in place. We'll school you with tips to keep your teeth in tip-top shape. Plus, we'll nail down ways to protect yourself from home repair scams and how you can avoid costly long-term care traps.
It's time to get geoing, so pull up a chair and join us at our kitchen table for Golden Opportunities. Accidents happen, but they really don't have to. Almost all injuries can be prevented, according to Dr. John Como, and he's here to help us put those preventative steps into practice. Dr. Como is the Associate Trauma Director and a critical care surgeon with Metro Health. Welcome to the show.
Thanks for having me.
Well, no one tries to have an accident, but they still happen. So what are we doing wrong?
We like to in the trauma community discourage the use of the word accident because almost all of these traumas that we see are potentially preventable. So car crashes from people that are drunk driving, certain types of motorcycle crashes, a lot of falls, and certainly the gunshot wounds and stab wounds that we see.
So just trying to be careful, right?
Try to be careful and not do things that you shouldn't be doing.
Oh, okay. So we're going to look at some different areas for safety and avoiding these accidents, starting with car accidents. What do we do to lower our risk aside from just not driving anywhere?
Well, for one, you want to obey the speed limit. You want to avoid drinking and driving, using drugs in driving, texting and driving. Always wear your seatbelt. These things will help prevent collisions, and if you do get into a collision, lessen the extent of the injury you might sustain.
Okay, good tips. Now let's talk about the home, safety in the home, particularly for seniors. What are some preventative things?
Well, I think the problems in the home are mainly seen in the senior population, the elderly who may become more frail. So, for example, things like things that might to be considered might be putting grab bars in the showers, floor mats in the showers, making sure that the toilet seats are of appropriate height.
This is all kind of fall avoidance, right?
All avoidance of falls, yes. We see a very large proportion of our elderly population that comes in because of falls. If a senior person is not very well mobile and they live on the second floor, well, consider moving down to the first floor to avoid the stairwell. Yeah. Exercise programs for seniors are also very important.
Okay, so we are also in the middle of a holiday weekend, and would we expect that accidents are going to increase, more likely to occur?
Usually they do, because more people are out, more people are doing things that involve drinking, more people are out in the sun, there are altercations that happen. So things do tend to happen more commonly on a holiday weekend, especially with nice weather.
Yeah, it was like summertime versus wintertime. Is there a difference?
There's a marked difference in our trauma population, our trauma census during the summer compared with the winter.
Oh, okay. If our efforts aren't really good enough and we do have a serious accident, whether it's car or at home or something, it's good to know that Metro's right in our backyard, right? So tell us a little bit about why is that the case?
They're trying to reach me right now, I guess.
Yeah. Hopefully there's no big trauma you need to be at.
Yeah. Anyway, we're the only level 1 trauma center in the region, in the Northeast Ohio region, above Akron and west of Youngstown. So we have 8 trauma surgeons that are available. There's always somebody in-house. So
24/7?
24/7. So we're available to the community when we are needed.
How many doctors how many patients do you see for that number of doctors?
We evaluate about 6,000 patients per year in the emergency department. About half of those get admitted to the hospital for some reason.
Wow. And folks can see more of these reasons up close and personal at the air show this weekend, right? Metro's a sponsor.
Metro's a sponsor, yes. Hopefully there won't be too many traumas, but if there are, we'll be ready for anything that might happen.
All right, so you're manning, the hospital's manning the first aid booth, right?
That's my understanding.
All right, well, hopefully nobody needs it, you're right.
Yeah.
So don't be an accident waiting to happen. Follow Dr. Como's advice. Small changes in your safety behavior and in your environment can result in big results. To learn more, visit Metro's tent at the air show or use the information that's coming up next. My thanks to Dr. Como for joining us today.
To learn more, call Metro Health at 216-778-7800 or visit www.metrohealth.org. Next, help at home.